Hello everyone. In this video we will learn about the concept of sanitation barrier. Sanitation barrier is a barrier through which the disease causing pathogens they are unable to reach the susceptible host either directly or indirectly. So we should remember the concept of 5F, and these 5F includes fluids, food, flies, fingers and fomites. So the improper disposed excreta that may contaminate any of the 5F which we have elaborated, and through them the disease is transmitted to a new host. So there are two types of barrier. One is primary sanitation barrier, another is secondary sanitation barrier. So the primary sanitation barrier, it focuses on the safe disposal of your human excreta. So in this we would not allow the organism to enter into the environment either directly or indirectly and contaminate these 5F. So if we are disrupting the transmission here, then it is your primary sanitation barrier. And how we can prevent this? By the construction of sanitary toilets or latrines. So we should remember the Government of India initiative like Swachh Bharat Abhiyan, which aims to eliminate the open defecation. So by using the toilets, we are preventing the feces to coming in contact with these 5S, and this is known as a primary sanitation barrier. Then we have a secondary sanitation barrier. So what happens when the pathogen breaches the primary barrier? So this is a primary barrier. So here the pathogen has already breached the primary barrier and it has reached your food, water or contaminated hands and flies. So here comes the role of your secondary sanitation barrier. So this is your secondary sanitation barrier. Now we have to take preventive measures to prevent the transmission of pathogenic agent from this into a new host. So what we can do in secondary sanitation barrier? We can do the food hygiene, food safety practices, safe water storage, vector control, purification of water and washing our hands properly. So all these measures would constitute secondary sanitation barrier. Now we will see some diseases which can be prevented by sanitation barrier. Viral disease remains a global challenge, especially in a low resource setting. And the common agents which includes your cholera, dysentery, typhoid fever, giardiasis, rotavirus and the norovirus infection. So these illnesses they spread primarily through the ingestion of contaminated water or food, or often due to the inadequate sanitation. And the primary presenting feature is the diarrhea. Then we have a soil transmitted helminth infection. These are the parasitic worms which hookworm infection, whipworm and ascariasis. So these parasitic worms they are transmitted through the soil which is contaminated with the human feces, and infection occurs when the individual come in contact with or ingest contaminated soil, often due to open defecation practices. Then we have poliomyelitis. So it is a viral disease that can cause paralysis and it is transmitted through the contaminated water or food. So immunization strategy and improved sanitation have been instrumental in reducing the polio transmission globally. And then we have hepatitis A and E. So we should remember hepatitis B and C they are transmitted by the blood-borne route, and the A and E they are transmitted by your fecal-oral route of disease transmission. So hepatitis A and E they are transmitted through the ingestion of contaminated food or water, and their outbreaks are often linked to the poor sanitation and hygienic practices. Schistosomiasis. This is a parasitic disease which is caused by the schistosomia worm, which is transmitted through the contact with fresh water contaminated with infected human waste. So although it is not endemic in India, it is of global health importance, especially in your African region and Southeast Asian region. And this is an example of water-based diseases. in which an aquatic host is present for the transmission of disease. Then we have trachoma. It is a bacterial eye infection which is leading to the blindness, and it spreads to the contaminated hands, clothing or flies which have been in contact with the human feces. WHO recommends the safe strategy for the elimination of trachoma. So that safe includes the surgery, antibiotics, facial cleanliness and environmental sanitation.